Good morning. Welcome to the OHSU Effect Inside Health and Science. I'm Lacey Evans. Today on the show, we're going to talk about some women's health issues, including lowering the C-section rate and pelvic prolapse. But first, we're just a few days away from May, which is Stroke Awareness Month. And with me now is Dr. Helmi Lutsep, professor and vice chair in the Department of Neurology. Good morning.
Good morning.
Okay, first let's talk about the cause of stroke for people who are unfamiliar.
Sure. So strokes can occur in a couple different ways. I should first mention that they can either be due to blockages of blood vessels, which cause what we call ischemic strokes, or they can cause a rupture of a blood vessel and cause a hemorrhage. The blockage kind is a lot more common, so I'm just going to focus on those. And those can come because somebody may have plaque, for example, in a carotid artery. A piece breaks off, travels with the blood flow to the brain, and causes a blockage to a vessel in the brain. Or the little piece of clot can come from other places as well, such as the heart, or sometimes even right at the site of a vessel abnormality.
What are the factors that can lead to stroke?
Well, there are a number, and luckily there are a lot that we can do things about. High blood pressure is the most common, and smoking is another one. If people treat their blood pressure or stop smoking, they can halve their risk of stroke. And then there are others that you can guess: diabetes, high cholesterol, lack of exercise, and certain heart diseases like atrial fibrillation can cause strokes.
And when we think of strokes, we think of them happening in seniors and in older people. But is that always the case?
It's definitely not always the case. Even little babies can have strokes. And strokes can occur in younger people, too, often due to different reasons from those in older people. For example, maybe due to injury to a vessel, but they can occur at all ages.
What are some of the treatments for stroke?
We treat strokes really in two ways. One is to try to prevent them from happening at all. So we talked about some of those, treating the blood pressure and not smoking and so on. But if somebody actually has a stroke, then we can also treat that in two different ways. So the main way is to use a strong blood thinner called TPA, and that's just injected into the vein. It needs to be given quite early. It works the best within 3 hours of a stroke, but can be given as late as 4.5 hours. And then in some cases where there's a really big clot in a vessel, we can also use catheters to go up to that clot and actually pull it out.
Yes, because we always hear that if someone is having a stroke, we need to call 911 immediately, because the sooner you get the person help, the better their recovery is. Is that true?
That is so true. We lose a lot of brain cells with every minute that goes by. So that's one of the most important things to remember, is to call 911 and get in immediately.
What are the challenges in treating stroke patients?
So one of the challenges really is that people don't always come in right away. And part of that is that strokes actually don't cause pain like heart attacks do. So sometimes people don't recognize that something very serious is happening, and that prevents them from seeking attention probably as quickly as they should. So if we had more people coming in on time, we could probably treat more strokes.
What are the signs of stroke? I think it's probably important to tell people that, since we're talking about getting them in as soon as possible.
Absolutely. So a stroke happens all of a sudden, and more commonly it'll happen to one side of the body. So weakness on one side, numbness on one side, sudden loss of vision, sudden imbalance, dizziness or vertigo, although those often come with another sign when they're due to stroke, and trouble talking, getting words either mixed up or slurring of speech.
So what should people do if you see a loved one who you think is having a stroke?
Absolutely. Time is of the essence. Call 911, and don't let the patient try to talk you out of going into the hospital, because sometimes the brain plays tricks on you, and they may not realize that it's serious.
Sure. Well, I'm sure we've come a long way in the past 20 years in treating stroke. So tell me about that.
We have come such a long way. We used to have nothing really to offer if somebody had a stroke, right in front of us. So many of these things that I've spoken about, the blood thinning drugs, the use of catheters, they've all been developed over the last 20 years. And now we do treat stroke as an emergency because there are things that we can do. Also, the stroke prevention, we're much more aggressive. We are more careful about treating blood pressure, cholesterol, making sure people get exercise, and so on.
You are the Associate Director of the Oregon Stroke Center up at OHSU. So talk about what is being studied there about the future of stroke treatment.
Yeah, we have all kinds of things going on. We are looking at other ways to prevent strokes even better. There's been a lot of focus on the bad cholesterol. Now we're even looking at medicines that might up the good cholesterol to prevent strokes, treating diabetes early, further adjustments in blood pressure. But I think some of the more exciting things we're doing also focus on giving opportunities to people that may have missed that time window. Say that they had been sleeping when their stroke started. Then they often don't get treated. We now are developing new imaging techniques that will allow us to tell which patients may be able to be treated, that they still have brain at risk, but it hasn't died yet. And if we can identify those patients, we could treat more patients.
Wow. So if you do have a stroke in your sleep, would you wake up from that, you think, or would you sleep right through it?
Some people may sleep through it. It varies a bit. And some people, unfortunately, fall out of bed when it happens.
Wow. Well, let's talk about ways that you're studying to help people recover from stroke. We've talked about treatment, but now let's talk about recovery.
Yes, I'm glad you brought that up because I think that's another really important part of stroke treatment, especially for those patients that did end up with a stroke and some disability. So we're doing studies there too. For example, we've got one that stimulates the muscles just below the knee to help people with foot drop, better able to lift the foot, and comparing that to an older device, a brace essentially, to see whether patients can get more function. And we've done other things too, stimulating the brain and even trying medicines to try to help some of the brain cells recover better.
Because a lot of people have paralysis on one side after a stroke, correct?
Yeah, paralysis can be a common feature. Not everybody gets it, but it can be. And we've now learned that even if you use physical therapy years after a stroke, you can still start to make changes. And we do offer very intensive physical therapy at OHSU too, even to patients that are years out from their strokes.
And if you've had one stroke, are you more at risk to have another?
Unfortunately, that is the case. Risks do go up. We think because of some of these advances that we've made in prevention that we can modify that risk more than we used to be able to.
Are there study opportunities at OHSU that people can take part in your research?
Absolutely. Our Oregon Stroke Center has the trials ongoing that I've already mentioned. People that have high cholesterol can, give us a call, see if they qualify, or patients looking for rehab studies such as those with foot drop. Absolutely.
So it sounds like people in all stages of whether they've had a stroke or at risk or afterwards can come to you to take part in this research that could help others.
That is correct.
How can we contact you?
So our Oregon Stroke Center, we've got an OHSU website, or our direct number is also 503-494-7225, and we can help direct you to the appropriate spot.
Great. All this information will also be on ohsueffect.org. You can also call the main hospital number, 503-494-8311, and they can help you with this topic or with anything else that you've heard on the show. Dr. Helmi Lutsep, professor and vice chair in the Department of Neurology, talking about Stroke Awareness Month. Thank you so much.
Thank you.
And don't forget, we offer the OHSU Effect as podcasts on our website, kxl.com. Just look for the OHSU Effect page. And if there's a health topic you'd like us to cover on this show, you can send me an email, lacey.evans@kxl.com, or follow me on Twitter @LaceyEvans, and just send me your suggestions. Coming up next on the OHSU Effect Inside Health and Science, we're going to learn about a pilot program involving OHSU and 13 other health groups across the state. It's called High Value Patient-Centered Care. The goal of the program is to reduce healthcare costs for insurance companies and to coordinate the best type of care for each high-risk patient. We'll talk to the project manager and 2 nurse care managers. And coming up at 8:35, we'll talk to a nurse midwife and a doctor about how the 2 disciplines are working together to lower the C-section rates, down dramatically at OHSU compared to other hospitals in our area. And after that, we'll talk to Dr. Mariana Denman about pelvic prolapse, a condition that many women suffer from. I'm Lacey Evans. Stay with us. In just 5 minutes, we'll have more of the OHSU Effect Inside Health and Science.